Brothers and sisters, my name is Sindiso Emmanuel. I'm greeting you here from South Africa. I hope that you enjoy. This is 2014, which is one of the years that have so much to tell about us, about our dispensation, about our holistic lives, Today, I will be continuing with the interventions for our state of health here in South Africa, in as much as we are currently experiencing problems in unmet needs, in family planning and child health, obesity problems, HIV/AIDS, which is one of the most deadliest diseases which is currently prevalent in our country. We are currently trying to create interventions of public health whereby our people can be able to have a way, a means of protecting themselves from various problems which emanate from how we respond to our environment, to other people, and how to maintain our nutritional state of health, our operations. Currently, being involved with the South African Institute for Arts, Public Health and Medical Anthropology here in South Africa, we're very much active in public health interventions, medical anthropology, which are very much relevant in our country. And in as much as there are developments which are taking place, we encourage our people to venture into these areas as much as it is necessary. South Africa is actually experiencing a transformation from the times of the colonial regimes to the times of the post-democratic South Africa. And in all doing so, how are the possibilities of creating a viable, healthy behavioral means amongst the people, and what is the way forward as well in terms of actually creating future goals or future programs which can be very much necessary in our own lives. So the concern about health is very much important because our health is more related to a lot of things in our society, and the more we achieve a state of health, the more productive our society and our own economy it is, So these are very, very much crucial interventions. As very much the Institute is currently open for people who would love to train as well as coaches, and also we have a program to help people on a weight loss program, challenge, beauty products, and other interventions that are very much helpful for you to achieve your good state of health. We also have an HR24G, which is operating in Pretoria, of which I'm working with various people on it, and we also have a lot of various items that we keep encouraging our people to get involved with, maintaining their own balanced nutrition and understanding of the diet. So in this current period whereby we're facing all these challenges, we encourage our people to become health conscious in this time because our health is very important. Also, I will be continuing with you about some of the programs that we're currently pursuing. I hope that you will be able to make a follow-up on our own programs, and also with the current initiative that we are currently doing. We just received an invite now whereby we will be shooting a film program about the death rates in Africa. Can you imagine how in Africa, we're experiencing the problem of death, especially on HIV/AIDS, which is the leading death cause in our continent, and is followed by problems of stroke, and heart problems, stay at number 2 in the statistics in terms of the dying numbers of people in our own country. So interventions are very quite crucial in various avenues, of which we will be exploring further to you so that we can be able to have a clear understanding of what we are actually talking about. I'm Sindiso Solontsi in South Africa, and I hope that you will be enjoying these interventions whereby we need to inculcate a culture of awareness. And in as much as the current intervention that I'm busy with, I'm helping young girls, to become active in sports at an early age in schools, because sports actually contribute to obesity, weight management, in as far as our country is experiencing obesity challenges. About 61% of women are overweight, and also a large number in percentage of these people are among the teenage girls in schools. So there's so much that is being reported, like the lack of inactivity, not participating in sports. It could either be the lack of resources, it could either be the lack of interest from our young girls. So now that a lot of sports have currently become so open to a lot of people, like boxing, soccer, rugby, which were previously set aside for only boys, but now they are currently open for everybody. And also I think it's a period of the real transformation, because these are the issues which we need to consider in terms of the roughness of those sports. But previously you will remember that women have also participated in wars, in defending their own country. So there's no way that we cannot be able to train our people. Human resources, they're always necessary. So imagine if we go for a war, defending, ourselves or the nation against whoever invade whatsoever. We would be having a large amount of people to defend the country regardless of its gender, So in olden days, people would only go men to the battlefield, but in other places, women were trained for the military. So these are kinds of the interventions that we need to promote. I will be going further to you tomorrow in elaborating about some of the possibilities that we can actually promote, that we can also be able to create a holistic way of maintaining our own well-being. I thank you, brothers and sisters. Sindiso Emmanuel from South Africa. I'm the Managing Director for the South African